Good day everyone, this is Mary Rose Garcia, a second-year nursing student from Section Weidenbach. So for today's video, I'm going to perform applying cold therapy or bag application. It is a local application of cold to the prescribed area with the use of crushed ice. First, you have to assess the situation to determine the appropriateness for the application of cold therapy. Also, confirm the physician's order including the frequency, type of therapy, body area to be treated, and the length of time for the application. Check if any antipyretic medications have been administered in addition to the cold application. Observe fluid and electrolyte status, especially the patients with elevated temperature. Assess baseline vital signs and hazards to patient's vital functions with the application of cold therapy. For the objectives, it is to promote vasoconstriction, to decrease edema, to relieve pain, to decrease temperature, and also to stop bleeding. For the equipment, we need to have ice bag, ice collar or glove, and then clean gloves, tape, small towels, waterproof pad, and bath blanket. First, we have to review the physician's order for the application of cold therapy, including the frequency, type of therapy, body area to be treated, and the length of time for the application. So this reviewing validates the correct patient and correct procedure. Next, we have to gather all the necessary supplies. This is to promote time management and provide an organizational approach to the task. Next, you have to identify the patient and determine if the patient has any previous adverse reaction to cold therapy. So, good day, I am your nurse for this night, and my name is Mary Rose Garcia. So can I ask what's your name, please? And your date of birth. Okay. So do you have any previous adverse reactions due to cold therapy? Okay. So identifying the patient ensures that the right patient receives the right intervention. And every individual has a different tolerance in specific therapies. Next, we have to explain the procedure to the patient to encourage the patient's cooperation and also to help allay anxiety and to give the patient what to expect. So for today, I'm going to perform cold bag application, and all you have to do is to cooperate to what I'm going to say. Okay? Very good. We have to assess the condition of the skin where the ice is being applied. So, assessment supplies baseline data for post-treatment comparison and identifies any conditions that may contraindicate to the application or treatment. Next, we have to perform hand hygiene since hand hygiene deters the spread of microorganisms. Close the door of the room or curtains to provide privacy to the patient, and place the height of the bed into a comfortable position since it provides or prevents back strains to the nurses or healthcare providers who perform the procedure. Next, we have to assist the patient into its comfortable position that provides an easy access to the area being treated, expose the area, and drape the patient if needed. will put the waterproof pad under the area being treated. So this is our waterproof pad. Positioning the patient and provide bath blanket could promote comfort and warmth to the client. And also, providing a waterproof pad will protect the linens from getting soiled or wet. Fill the ice bag with 3/4 full of ice. We have to remove any excess of air from the device and securely fasten the end of bag or collar. Tie the glove close, checking for hose and leakage of water. And also prepare commercially ice packs if appropriate. So ice provides a cold surface and excess air interferes with the cold conduction, and fastening the ends prevents leaks. We have to cover the ice bag with towel or washcloth to prevent the skin and absorb condensation. Like this. After that, we have to put on gloves. Position cooling device on top of dressing. And lightly secure in place as needed. Use of gloves and leaving the dressing in place prevents the spread of microorganisms. Proper positioning ensures the cold therapy to the specific area of the body. So after 30 seconds, we have to remove ice and assess the site for redness. Also, ask the patient for the burning sensation to prevent burn injury. So, do you feel any burning sensation? Replace device snugly into the site if no problems are evident. And secure it in place with gauze wrap or tape. Wrapping and taping stabilizes the device in proper location. So, this is our tape. After that, we have to assess the treatment every 5 minutes or according to agency policy. Since assessment of patient skin is an early detection for adverse effects, thereby allowing prompt intervention to avoid complications. After 20 minutes or the prescribed amount of time, we have to remove the ice bag and dry the skin of the patient. So we use this extra towel. Limiting of time of application prevents injury due to the exposure of cold. And prolonged application of cold may result in the decrease of blood flow with resulting tissue ischemia. A compensatory vasodilation or rebound phenomenon may occur as a means to provide warmth to that specific area. After that, we will apply a new dressing to site as necessary to provide the patient's skin. Lastly is to remove your gloves and perform hand hygiene, since hand hygiene meters the spread of microorganisms. For the evaluation, edema is slowed and reduced locally. The patient's internal temperature is reduced. Also, the pain and bleeding is reduced or alleviated. For recording and charting, we have to record time, location, and duration of application. Describe the condition of wound or skin before and after treatment, as well as science response to therapy. And lastly is to report unusual findings to the nurse in charge or physician. So that would be the coverage of our cold bag application. Again, this is Mary Rose Garcia, a second-year nursing student from Section 1 Thank you and God bless us all.